ABC News contributor and Chief Innovation Officer at Boston Children's Hospital, Dr. John Brownstein, for more on this. Dr. Brownstein, these pediatric hospital admissions hitting the highest level in 2 years. How concerned should parents be at this point? And can we hit a point where hospital beds are just full?
Well, Diane, good morning. I am very concerned. I mean, I am in a pediatric hospital and we're experiencing these surges, and this is happening across the country. It's happening much earlier than we would expect, and it's possible because, kids are grouping together, not wearing masks, and have a lack of immunity. We're seeing that surge in RSV cases in addition to other things that we're having to deal with. And so, yes, I am absolutely concerned about our capacity constraints because when you get increased capacity, then you have a challenge of being able to deal with other potential issues with kids, and you have to cancel elective procedures, and that's a real concern. So we're actually seeing some states well over 80% or 90% capacity, and I don't expect it to get much better because, of course, we have a flu surge that we expect, potentially COVID. Altogether, it's going to make for a challenging next few months.
Now, Dr. Brownstein, I have 2 little ones at home myself, and I know that if I went to the ER every time they had a cough, I would be living there. So how do you know when it's something that is serious and really needs to be professionally evaluated?
Right, Diane, I think it's a really good point. Our kids are, I have 2 kids as well. They get sick. It's something that you can manage for the most part at home. And remember, RSV is something that most kids get and deal with no problem. But of course, if your child is dealing with any real trouble breathing or wheezing, absolutely you should call your pediatrician or primary care provider. You're looking for that fever and fast labored breathing, any body aches, things that look more serious. Of course, it never hurts to call your pediatrician and figure it out. But yes, do that ahead of maybe going to the emergency department because they are overwhelmed right now.
And we can't keep our kids in a bubble. So what can we do to try to protect them?
Right. We can't do that. And we want them to get the exposures in the real world. But you can practice good hand hygiene and respiratory hand hygiene. Obviously, washing your hands is still good practice no matter what. Avoid being around people who are sick. And if you're sick, stay home. If your child is sick, please keep them at home to avoid spreading on that infection. And of course, we do have vaccines for flu and COVID. Those are available. Now's the time to get them, to be up to date on your vaccine. So do the things we can, and then of course, deal with what comes our way.
Now, RSV can also affect adults. So how much do we have to worry about contracting this from our kids or somebody else's?
Well, because we've been exposed as kids, we have some level of immunity, but adults can get sick. They can get cough, runny nose, sore throat, fatigue. For most people, they will deal with this no problem, but in our older adults, it can be serious, and especially adults with complications. And we actually see over 150,000 hospitalizations every year from RSV in older adults, and 14,000 die from this virus. So it can be serious in our older population, which again means that we need to do everything we can to limit the spread of these viruses in the next few months, especially.
All right, and I want to shift to COVID for a second because President Biden is scheduled to get his updated COVID-19 booster today. So give us the update. How many COVID shots should we have received by now, and how much protection against COVID-19 does this latest booster provide?
Right. There is a lot of confusion, and I recognize that when we look at these surveys out there, there's a lot of confusion amongst American people of what you need in terms of be fully up to date. The president actually had COVID 3 months ago, so is getting that updated booster now. It makes a lot of sense. But only 20 million Americans have gotten that updated booster, and I think there is some confusion out there. You've either had 2 boosters or 3, depending on your risk categories. But generally speaking, most people will become eligible for this newest booster. I know I've gotten mine, and it does make a big difference. The data is clear that if you're boosted and fully up to date, your risk of infection is lower, your risk of severe illness is lower, and your risk of death is lower. So absolutely makes sense, but there is a challenge in getting that rollout. And this is why the Biden administration is putting up pop-up clinics, is doing a media campaign, trying to figure out how to get vaccines to meet people where they are.
All right, Dr. Brownstein, we appreciate it as always. Thank you.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.